Good afternoon, sir. How are you doing?
DaShawn, good afternoon to you. Good morning and good evening. I often kid with folks that it's tomorrow in tomorrow in Australia. So, so what does that mean about time?
Yeah, you know, because there's a couple of people I work with that are in different time zones, and when we call each other, it'd be like 7 o'clock in the morning here, 8 o'clock. It'd be midnight over there. Very, very funny.
Yeah, but I don't remember voting on the time zones. I don't remember my any. I mean, these political and social and economic conventions are fascinating.
Yeah, I'm wondering when they're going to stop daylight savings.
Well, there's a lot, and that actually that kicks in to what we're going to, in a way, in terms of what we're going to be talking about today in terms of epidemiology, because as you know, there's a lot of research about the negative impacts of daylight savings on some client, some
Exactly.
time zones, et cetera. So again, Dr. DaShawn Robinson is with us, and I met DaShawn last, I guess two Saturdays ago now, not last Saturday,
Yes.
but Saturday before. And really shout out to Virginia Spell and Lisa Kelman for holding an event at Bethel AME Church about the Elm City Summit and the state of the Elm City. I was really intrigued about the title and was really anxious to be there and was blessed to be there and had a chance to meet you. Uh, DaShawn, let's kick it off. What I was um, I know what your slave name is, you know, but but you have uh, symbols and letters behind your name. So let's break. Let's dive into those to kind of share with people. And I half joke, but I really it's kind of a backhand. And I mean, let me say backhand, but forehand compliment on really just achieving and aspiring and I know you got many miles to go in your life and you haven't you're not looking for exits but you're looking for multiple on-ramp strategies at
Yes,
the
sir.
moment uh but we have DHSC, we have MHA, we have MSC, we have LSSBB. You know, so break that down a little bit because I think it's helpful for people to know a little bit about your academic journey, and then we'll get into the your personal journey and your vocational journey, which is all kind of course, intersecting.
Yeah. Thank you very much. And again, it was definitely a pleasure getting a chance to meet you, and I'm very excited to get a chance to talk to you today. Um, the initials behind the name, it was something that I had my sister tell me, you've earned it, you need to use it. I've had other people say, when you earn certain accomplishments, you have to use them so people understand. And
Hmm.
the MSc behind my name is when I received the Master's in Information Systems.
Hmm.
Um, the MHA, I received a Master's in Healthcare Administration.
Mm.
And then the DHSC is I received my doctorate in Health Sciences.
And
The LSBB is something that I just received a few months ago. I got my black belt in Lean Six Sigma.
oh man. Oh man. So and you're only 13, so I mean that's quite an quite an accomplishment. I'm not going to ask you your age because then you might like do the goose and the gander and ask me what my age is and well I don't know. I actually I shouldn't put it that way. I'm kind of proud of my age. I have to embrace it. Next month, July, I'll be 75, so that's kind of
Really?
yeah.
Wow.
Well, so I mean, I wasn't I guess I was I don't remember being there 75 years ago. I mean,
See,
I had the birth certificate, but my memories were kind of challenged at that point. Uh, but I have a birth certificate, and so it might have been a case of identity theft. I mean, everything's kind of conspiratorial in
but
these.
no, I mean, when you say it that way, I know I have a friend of mine who said, and I'm not really a birthday person, don't really celebrate them that much, but she said every year that you've been alive, especially as a black man, you should be proud of. So when you say
Hmm.
those things, I say really because you don't look your age. That's where I say really from, not because of any other surprise, but you kind of strike me as somebody late 50s, So that's why when you said I go, oh, interesting, but very, very well accomplishment, you should say.
Well, I appreciate that, and I do have a a positive tale to tell. But these next 45 minutes are about you, Dr. DaShawn Robinson, senior. So
And that's the best initials after my name. So the
mm,
DHIC and all of those things. But the reason why I say that's the best accomplishment is because what is it? Three or four of those letters that come after my name came after the senior. So I'm very,
mm,
very proud of having a son who's a junior. And every single one of those letters came after he came. And like you said, the door is just starting to open because I'm going to make sure I open so many doors for him and my other younger son. That's why those initials are more important than any other initials I will ever have after my name.
excellent. You know what? And on that note, not to go through your total origin story, but before we get into like epidemiology and business and health administration and health and healthcare, talk to me about the do you can you point to a time when, say, when you were in your third grade or fourth grade or second grade or eighth grade in terms of this, or have you, your kind of vocational aspirations and your professional accomplishments? Can you point to a time where you, was it a teacher, was it a book, was there what was it, one moment, or was it a series of moments? I'm just always curious about how people get stimulated to walk on the path that they choose to pursue.
Very, very interesting. And there were a few different milestones that got to me where I am now. I would consider myself no different than any other young male who played sports. I was
Mm,
only involved in education to play sports.
mm,
And I kept average grades just to play sports. And I remember it was in high school. The first person who challenged me was my high school guidance counselor, Mrs. Young. And I
mm,
still wish to this day I can find her and figure out where she is because I can thank her.
mm-hmm,
She challenged me because when I reached my senior year, she said, you met all the requirements. You can have all these open ended. You only have to be here for 2 periods, but I challenge you to take more courses. I thought she was crazy. I was like, why? She was like, because I see you as a teacher. And I was like, do you see my report card? That doesn't speak like I can be a teacher. And then what ended up happening was she came to me February of my senior year. So I just say that because it's February. I'm going to graduate in June. And she said, I spoke to your younger sister. And she said she's going to do whatever you do after you graduate. She's going to follow you because you're her idol. I said, okay. She goes, so if you stay home and work and just get a regular job, she's going to do the same thing. But I see
mm,
her as being more. So I said, okay, what should I do? Go to college. I said, how? It's February. She gave me a couple of college applications. I filled them out, went in, had the interview with one of the schools, which was Central Connecticut State. And I never forget the lady said, well, you have average grades. I see that you're taking all your courses, which shows aspiration, but why do you want to be here? And I told her, because I want my sister to go to school, so I want to show her that she can do it. And
mm,
she goes, okay, so what would you tell me if I let you in? I said, I guarantee you, if you let me in, I'll graduate. She said, I'll take a chance on you. I graduated. My
mm.
sister went off to school and followed me, went to the same exact school and spent the same amount of time. So that was the first challenge I had in my life. And I did that. Afterwards, played sports, did what I wanted to do, was football, martial arts. Then it came to a point where I had children.
Mm,
And when I had my child, that was that next spark. So I got my degrees, and then there was a 15-year gap before I went back to school to
mm.
continue my education because of the fact that I got my first bachelor's, got my master's, went to work, and I've been working in healthcare for 15 years and was fine. Got married, had my son, and that's when certain things came up. And I said, you know what, I'm going to make things better for him, and I want to learn more because I don't understand what's going on. And that sent me back to school.
Mm, mm. And did you you referenced high school? Is that here in Connecticut?
Yes, I was born and raised in Norwalk, Connecticut. Went to all Norwalk public schools. Graduated from Norwalk High School. I was I'll mention this community center, the George Washington Carver Foundation in Norwalk. So if anybody
Mm-hmm.
on your shows ever listen, if you ever heard of it, I grew up in that community center since I was 4 years old,
Mm,
under the tutelage of Mr. Richard Fuller. He was there when I graduated college. I mean, high school. I have a picture of when I graduated high school. He was there at my college graduation. He passed away a few years ago, but this was one of those gentlemen who actually was there, who was in the community, who made a difference. And I thank him for a lot of what happened. I looked at what he's done, how he mentored and helped other young boys, and then when I had my own children, of course I'm going to help mine, but I seen the importance of helping others, and that's where you can see. And we'll talk about epidemiology, public health, population health, and how I'm trying to help not just my own but others as well.
So sure, let's jump into to the road that you're paving and trying to make it smooth for others and trying to prevent people from taking exits and taking the wrong turn and getting stopped and who knows what else happens after you get stopped in spite of your maybe not driving illegally, but from some people's perception of your driving illegally. But yeah,
Mhm.
let's talk about epidemic that word epidemiology. And it's us. I mean, basically the translation is uses. So
Yeah.
um, so break it down a little bit because it's clearly a passion of yours. And again, by hearing you 2 Saturdays ago, so I was so pleased that you could kind of make yourself available. And so let's talk about behavioral health and epidemiology and actually the preventative health, which I really like. You mentioned that phrase to me.
Oh yeah. And that's where it all happens. And for me, the journey was I was always in healthcare from the administration side. I had a did my bachelor's in business administration. I wanted to be on the business side of it because I was thinking about more of building enterprises and being more effective that way. I had the American dream of building something, owning something, um, making money. I'll be honest, making money. That was what
Hmm.
the American dream was, and that's what I thought it was about. And when I went back to school, I decided to do healthcare administration because I was working in healthcare administration and I wanted to be management. And the
Hmm.
reason why, and I'll say this because it speaks towards the equity and equality and some of those factors. I've been working in healthcare, but I'm very much a quiet person. You ask me to do something, I'm gonna get the job done before time, best of my abilities. I always got praised for the work I've done, but they never moved me forward like I seen some of my counterparts moving forward when they weren't doing the same quality of work I was doing. So it kind of disturbed me. So I finally worked up the nerve to ask a manager, why am I getting promoted? Why am I becoming a manager? And they said, well, you're quiet. We thought you just prefer to come in, do the work, and just get the work done. Not everybody wants to be a manager. So I said, okay. So instead of speaking about it and talking how I wanted to be a manager, I decided to go back to school and get a degree in healthcare administration to say, well, see, I'm telling you that I want to do it without me telling you. You know,
Hmm.
that was the thing. I've seen too many people arguing and fighting back and forth. And what ends up happening is when they do reach that step, some people are just waiting for them to fail so they can say you wasn't supposed to be here anyway. So I went back to learn how to do it. And that's where the journey was. But when you say epidemiology and how did that happen, when I was doing my studies as a healthcare administration, I had my son. I really focused. So I went from being a 2.0, 2.2 type of student, just making it just to play sports. And when I went back to school, I said, you know, I'm going to make this what I needed to be. So I ended up graduating my healthcare administration with a 4.0,
Mm.
top of the class. Um, got into the honor society for healthcare administration, and that's where it was my focus. And I wanted to show that I can do everything I needed to do. In that process, one of the professors said, you should enter the doctoral program. I see something better for you. I see you changing things. Professor Olmsted, he challenged me. He said, the future is healthcare administration and you belong in the future. So you should actually attack these things. Dr. Mingus, who ended up being my chair, he said, I think you should enter this program. He wrote me recommendations. He got me into the program. And I took that seriously and I graduated my doctoral studies with a 4.0 as well.
Mm.
Uh, Top of the class. And that was those areas. But I was looking at healthcare administration side of it and going to do that route. But, sharing personal side, my first son, who I'm more proud of than anything ever, my junior, DaShawn Robinson Jr., when he was born, um, he came out light. He was talking, he was doing certain things, but then all of a sudden, about 2.5, he started to slow down, and I'm like, well, what's going on? And we went to go bring him in and get tested, and they said we believe he's autistic.
Mm.
And I'll say for myself, and this may touch some other people, I said, no, he's not. I don't think y'all know what he's talking about. He'll be fine. Everything will be okay. And we didn't do certain things. And I said, he'll be okay. Everything will be fine. My wife, who is an educator, has reached a level of assistant principal. She's worked with kids. She's seen these things. And she was like, no, I think something's there. And then finally, when I started to look into what autism was, I started to look into my son and see he had the symptoms.
Mm.
And it made me feel bad because I said, I disregarded them because I didn't have any knowledge on these subjects. But
Hmm.
this was right around the time I started my doctoral studies. So I shift my focus from IT and technology and business administration to now public
Mm.
health and population health. And that's how that focus got started because epidemiology is all about looking at those determinants that trying to identify what's wrong and finding out what is the determinants and the distribution of those determinants across population. So it's not
Hmm.
just about one simple thing, but it's okay, what is affecting autism for young males, young females, African Americans, European Americans? So you're looking at a different spectrum and you're trying to understand the disease as a whole and how it spreads. So then you can understand how to effectively create solutions to improve them. And that's what my
Hmm.
whole focus has been about.
Mm. And again, for the doctoral program, that was at the, correct me if I'm wrong, at the University of New Haven.
Yes, yes. They have a Doctor of Health Science program where it's more of an applied study and you're doing healthcare leadership or educational leadership. And I was able to be a part of that first cohort and join that program. And like I said, I'm actually proud that I was able to graduate top of the class 4.0, did my studies and still continuing the studies that I've done. So very, very proud of that.
Excellent, excellent. So um, where do we go from here in terms of DaShawn Robinson? I know you're involved with Evolve Back. Perhaps let's talk about that a little bit. It's and the Claire Robinson Foundation. But give people a feel for how, because we hear this term Renaissance person, and you
Mhm.
certainly are a Renaissance person. But where are your buckets of strategy implementation? How do you kind of spend your days, and how's the community benefit from DaShawn Robinson being on the planet, senior being on the planet?
That's the $1 million question. I'm trying to limit myself from doing as much as my mind wants to do. So I have always said I would rather be somebody who knows a little bit about everything than knowing everything about one subject because I want to
Mm,
always be able to be in the conversation and know. Knowledge has become very, very important for me. And where it's taken me to, you can see, I'll start with the Claire M. Robinson Foundation, which is become a staple. Again, my grandmother, Clara May Robinson, raised me from a young boy. My mother passed away when I was very, very young. She took me in, me and my sister, and she raised us. We grew up just like anybody else. And then she's always complained about certain illnesses and certain factors and complained for a long time. And then finally, it was around 2014 or so, she found out that she had breast cancer.
mm,
After complaining for so many years, what did we do? And I remembered when we were there, me and my sister said, oh, ain't nothing wrong with her. She just complained. She wants sympathy, whatever, whatever. Same thing I did with my son when he was born. Nothing's wrong, he'll be okay. That really sticks with me because it was like you're ignoring those factors. And when she passed away in July of 2017, it wasn't until October we said, we should do something in her honor to honor her because,
mm.
the one thing that she did that still drives me crazy to this day is this woman opened her doors to anybody. I lived with so many strangers in my home. She would open her door. Anybody in the streets that needed help, she would help them. Food, take them in. We had people live with. So I looked at how she lived her life, and then I said, we should do something to honor her. But it was already in the middle of the month. I said, well, let's wait till next year and we'll do it. Again, big thinker. That event to honor her turned into a foundation, and the
Mm,
foundation started off with I wanted to do stuff to break awareness and early detection for breast cancer for people at high risk because
mhm.
she might have had it longer, but when they said they found it, it was too late to do anything. They just made her comfortable. She lived for another couple of years and she passed away of the disease. So that's what the foundation focused on. And it started in 2018, but 2020, the pandemic shut us down just like it did for everybody else. We
Mm.
weren't able to do much. And in those time periods, I went back to school and I got my doctorate degree. So the foundation now is still about early detection, identification, early detection, and awareness around not just breast cancer, but all types of health issues. And that's where the
Mm.
epidemiology came in because I brought those studies into the foundation. So we're still doing breast cancer awareness. We have 2 research studies going on about breast cancer at the moment. We're trying to bring awareness around it. We've also added in other elements because I realized there's other health factors that can go into it. So I'm taking that knowledge that I've learned, bringing it to the foundation, and that's what we're growing. But then Evolve Back is a organization that I created a long time ago as an entrepreneur. I've always been trying to build different things. I've owned different areas. And Evolve Back is looking at now focusing on healthcare. How do we partner with healthcare organizations and use my knowledge that I've obtained in business administration, business consulting, as well as healthcare improvement, which is my Lean Six Sigma background? And how do we actually
Mhm.
effectively work with these small healthcare organizations and improve their efficiencies, their operations, their processes, their performances to make them better so we can then effectively make the healthcare system better and effectively help drive down those costs, make more people able to get healthcare. So there's a big connection and correlation with a lot of the stuff that we're doing. I'm just trying to be a small part of it, but I'm trying to grow. And like you said earlier, the door is just opening. And hopefully one day, what mark I leave on this world is that my two sons can pick up after me what I'm doing, and the work that I'm doing can go help everybody long term versus just in the short term.
I want to go back to the research in a second that you mentioned, but if the in terms of client development, if someone's listening to this show and wants to a business or an organization that wants to really not take advantage, but just expand their horizons of being connected with you. Well, so in terms of your customer base or client base, what are some of your clients that you're seeking or customers that you're seeking? What in terms of the business development for your not your empire? Sometimes it has a negative connotation, but
My passion.
for your passion and legacy.
Yeah, I know right now, and it's interesting. I just had a conversation because with the foundation, we were able to start an internship program. So we've partnered with the University of New Haven, and we're going to be looking to partner with other schools
Mm-hmm.
where we've brought in interns. So right now, I have 13 interns out of the University of New Haven working with me, and we just had a meeting right before you and I began this conversation, and we're working on one initiative where we identified an organization is right here out of New Haven.
Mm-hmm.
They're looking at trying to make health better for obesity in the
Mm.
community, and they're looking at using healthy foods and how to get more healthy foods in there. They're working with local farmers. So we're
Mm-hmm.
just identified that group, and my team is now working to make communication with them, get an informational session, see exactly what they're doing, how we can
Yes.
bridge the gap. And we don't want to duplicate the efforts that they're doing. So we finding people who are doing the things that we want to do, figure out where we can add in the missing pieces, and then we work together. So Wholesome Foods was one of the organizations. We're trying to work with local farmers markets. We're trying to work with gyms and exercise areas where we can effectively get certain things to combat obesity. We're looking at different illnesses, and I say obesity just because of the fact that I said it earlier, but
Mm-hmm.
we're working with a lot of different organizations. Our primary goal is to work with anybody who's focused on health and health care.
Mm.
That is our primary focus for the foundation and the Evolve Back organization. Business wise, I do like to help other small entrepreneurs because you never know the next unicorn where that would come from. And I'm always there to help any entrepreneur who's starting out either with an idea or small business, just helping understanding what is it like to do business administration, getting business intelligent, making more moves, making things more productive for them. But my primary focus is working on health and healthcare, first starting off in Connecticut, and then hopefully we can go nationally, globally, whatever we can do.
Excellent, excellent. And if folks are listening and want to kind of connect with you or brainstorm or kind of lend their services and vice versa or utilize your expertise, what's the best way for them to contact you?
Best way for me, and I'll say this too, I'm not a proponent of social media, so I don't have any other social media except for LinkedIn now. And I only got LinkedIn after I finished my studies because exactly what you just said, my professor said, if somebody wants to connect with you and collaborate, how are they going to get in touch with you? So right now, the only means outside of phone call or email is LinkedIn. And again, I met you in the church. We met in person, but we've connected over LinkedIn. And my LinkedIn is my first name, DaShawn, last name Robinson. And again, those 50 million symbols after my name, that's my LinkedIn account. But that's the best way to get in touch with me. If we don't, I've actually got in touch with a few people. They've reached out to me on LinkedIn. I'm mentoring and helping people that are actually about to start their doctoral studies. I'm coaching a couple
Mm-hmm.
people in their doctoral studies. I'm working with some people trying to get them internships and mentorships in medicine. So I'm trying to do a lot, and LinkedIn has bridged the gap a lot for me in connecting with people in the community.
Excellent. Are you willing to share? We want to, Alexander Graham Bell has had an impact on American history. Do you want to share your cell number perhaps or your business number?
Oh, of course. Business number is 203-684-1250. And that's my direct line. It comes directly to me. It's one of the numbers that I keep with me most of the time. So that's the business number. Pretty much answer that anytime throughout the day. most likely 8 a.m. to about 5 or 6 p.m. That's the number that I can be reached at.
Perfect, 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 perfect. Dr. DaShawn Robinson Sr. is with us. Let's kind of take the deep dive in terms of this preventative health situation as well as the status of black males in particular, and you reference even your family connections and your generational issues, certainly in terms of breast cancer and autism, that whole people are using the term spectrum, and I'm
Yeah,
amused. I shouldn't say I'm amused, but that seems to be that it indicates that we're still understanding the spectrum
exactly.
enlarges. So rather than saying we don't know all the different indicators, we'll use this word spectrum.
Yep.
Uh, uh, but yeah, preventive health and young men's, and what have you observed, and where are we going in this regard?
I like how you said that too, and with Spectrum. Um, that's where I love to put myself at, in the
Mm,
unknown. Somebody has said before, when you look at bookshelves and you try to understand about health, the shelves that have the limited amount of books and knowledge is because there's a limited amount. That's what the subject is. But when you look at mental health, there's 500 million books out there because nobody really knows what it is.
mm,
When you talk about that spectrum, when you look at autism, for instance, what I've learned about autism is there's two different categories, main categories. And for a person to be diagnosed as autistic, they need to meet 6 out of the 9 markers in both categories. If you
mm,
don't meet 6, you're not considered autistic, but you're still on a spectrum somewhere. So
mm,
when you look at those spectrum, like my wife had this conversation with me before, you know, I'm shy or I don't really speak when I'm around people. Sometimes I get a little awkward. I can be considered autistic because I will be on that spectrum too. But
mm,
when you say spectrum, anybody can be on there. They look back at past history and say Albert Einstein could have been autistic because of who he was. So it does make you think about it, but that brings you into the discussion of preventative health care.
mm-hmm,
Healthcare right now in the United States is about 17% of the GDP, global domestic product. We spend about $25 billion in our products and service.
mm,
Very, very, very expensive. And out of healthcare, there's over $4 billion spent in healthcare. That's products and services, both public and private. But we do not rank anywhere in the top in healthcare performance.
mm,
So we spend the most money over all nations, but we're ranked somewhere in the middle as in
mm,
performance. So the one thing I look at is preventative healthcare. I'm somebody who I personally do not like going to the doctors. I don't like taking medications. I get a headache. I just let my body heal it. I'm a proponent of self-care. So when you think about preventative healthcare, it's how do you effectively get involved in your own healthcare to understand what's going on, to know if you need to go in to see somebody, and if you do go in to see somebody, understand what they're telling you and not just take somebody's word and do what they're saying. So that's not saying there's no need for medicine. It's just saying you need to be more active in your own healthcare. And
mm-hmm,
for somebody like myself, I never used to go to the doctor. I feel fine, nothing's wrong here, everything's fine. And then when something happens, I go to the doctor. So we're working with something now called digital health. And digital health is about those devices that help you monitor your own healthcare. There's blood
mm-hmm,
pressure medicine devices that you have. There's different ways to monitor your own healthcare, see when certain things are going on. So we're really promoting preventative healthcare because the healthcare system is moving from what was called fee for service medicine to value based care. And what that means is if I get sick or injured and I go to the doctor, whatever they do, whatever fee they perform, they can charge a service for. I come into the hospital, that's a fee. I go into that room, that's a fee. The doctor checks me for this, that's a fee. My sister made a comment. She said, I went to the doctor for a physical. He asked me what's bothering me. I said, my leg hurts. And then when I got the bill, I got a physical charge and a leg review charge, but he never even touched me. But since he talked about it, that's another charge because
mm,
that's a fee for service. So now they're trying to move to value-based care, which means they want to pay providers to not only treat you, but make sure they take care of the population. And that's where population health and
mm,
epidemiology comes in.
mm-hmm,
So if you think about it, if a provider is looking at somebody getting sick in the community and they come to the hospital, instead of everybody coming into the hospital, how do you effectively treat this person, but then go out and treat the community so they don't have to come in, but we'll compensate you for that. And that's where I look at preventative medicine, trying to educate people on the small things that they can do to understand their own health And when they understand their own health, they can understand what's going on. Once they understand what's going on, that's less trips to the healthcare. That's less trips that they have to make to the hospital. That's less money that has to be spent. Then maybe the insurances can start charging less premiums for us because you don't have to pay as much premiums because not that many people's going to the hospital or going to a doctor's office. But then maybe they can open up more services because now you spend so much money for insurance, but then insurance dictates how much they're going to pay. So if I'm
Mm-hmm.
paying you, let's say $5,000 a year, but then you're saying that you're only going to spend 1,000 of my money that I pay for you to take care of me, what are you doing with the other 4,000?
Mm.
Oh, that's going to take care of somebody else who. So it's too much going on that we don't identify and realize, and that's why I think the first step is just identifying your own health, understanding that we live longer now. Before there was a
Mm-hmm.
life expectancy at one time of 30 years, then it went to 40 years, 50. Now we're living almost 80 years. But around 40, 50 is when your body starts to break down. Do
Mm.
you want to live longer but unhealthy?
Mm-hmm.
So that's where, I like the preventative healthcare. I like looking at those measures. How do you identify, like, first of all, how do you prevent illnesses? How do you prevent
Yes.
these things coming? That's number one. But if you cannot prevent them, you need to identify them early, be able to diagnose it, not self-diagnose, but identify something's not right, go to the doctor, get diagnosed, and then effectively treat it so that these problems don't linger and cause other problems.
Mm.
And
Mm.
that's what I like to look at.
Mm. Mhm. And I see the smile on your face. And does the you referenced, and correct me if I'm wrong, about your martial arts involvement,
Ooh,
correct? So
yes.
how does that kind of does that integrate or relate or align with preventative health and body, mind, spirit kind of cultivation?
Yep. The one thing is, somebody asks, what does it mean to be healthy? We have a bunch of different definitions, but the ultimate term of being healthy is being completely comfortable and happy with your health. But what
Mm.
are the factors of health? Mental health, physical health, social health, environmental health, spiritual health. They are all factors that accumulate. I can be completely mentally healthy, but my body's not working. So I'm not healthy. I can
Mm-hmm.
be healthy spiritually, but not healthy mentally. So if when you align all of these factors, and for me, my passions outside of is sports. Martial arts is one of the things that I've loved since I was a child. Wasn't really able to get into it because of monetary factors when I was younger. So once I got a little older and was able to do it on my own, I was able to get into martial arts. I've been a boxer, Golden Glove boxer, fought in Golden Gloves, carry a Golden Gloves title. Did karate, did taekwondo, did kickboxing, Muay Thai, wrestling, judo, jujitsu, done all of them. Did mixed martial arts, competed, but all of that was just the sport of it. But what happens is it helps you get mentally right. And
Mm.
I think the first step of being healthy is having your mental health correct.
Mm.
So that's why I want to focus on mental health because, like I said, there's thousands of books on there, but there's no real answers. So I want to see if I can get in, provide some type of experience and knowledge into that realm of mental health. But if your mental health is healthy, you'll understand that you need to get your physical health healthy. You'll understand to get your spiritual health in line. You'll understand to get your environmental health in line. You'll understand all these other factors if your mind is correct. So that's where martial arts has done something for me, learning how to meditate, learning how to understand how to control my own actions. I used to be an angry kid. I was short, always got picked on, ready to fight at the drop of the dime because I had the Napoleon complex. But once I got into martial arts, like road rage went away. Somebody bumping into you the wrong way, you looking ready. That went away because I'm in a gym. I'm training with people who are equal as me, less than me, higher than me. Some days I win a match, sometimes I lose a match, but I don't need to have that focus and aggression outside of it because I'm balanced inside. And that's what
Mm-hmm.
martial arts have done to me. I've been in martial arts, and as you say that, I started training my sons who are
Mm.
9 and 7. I've been training them with martial arts. I just took them to a studio. They may go in, do martial arts, so now they can be involved with other children, not just their dad showing them some things. But martial arts is one of those areas. Let's say you're not physically into the martial arts, meditation, any type of thing that can get you to calm down, relax, understand your mind, your thoughts, your emotions, because that's what all is about. Your thoughts affect your emotions affect your behaviors. And that's what
Mm.
I believe in.
Mm. So say that again. Not the last 5 minutes, but just that phrase. Just that phrase, right? That nugget. Say that nugget, right again.
If everybody looks at it, your thoughts affect your emotions, and your emotions affect your behaviors. So what you think determines how you're going to feel. and how you feel determines how you're going to behave. And that's why I'd say it all starts with mental health. If I'm
Mm-hmm.
a drinker or a smoker, that's a behavior. But how am I feeling? Why do I feel like I need to drink? Well, what am I
Mm-hmm.
thinking that makes me feel that way? And that's why I use that analogy.
Oh, for sure. Absolutely. I've been involved with some groups that are really concerned with this, the Food and Drug Administration proposal in terms of menthol ban. And again, the Biden administration not accepting those regulations. And it's really these poison sticks that the government allows people to sell. But
Yeah.
again, but if you consider that we've been targeted to kind of and brainwashed to buy these products, it's really fascinating. Uh, insert some of what you said, Dr. Robinson, on terms of the political environment at the moment, the crisis in Sudan and Middle East and Haiti, and not to mention these so-called presidential debates that'll take place. I hate the term presidential debates. I prefer we need it should be a national discussion, not a boxing match in terms
Yeah.
of two people against one another, but really a full-fledged these presidential debates do not offer up a national discourse. But how do you talk to me about your perspective on how people because so many people are tuning in my mind are tuning out, understandably so, in terms of the chaos that they perceive in society at the moment. Um, just wonder what your thoughts were about that. How to remain healthy and whole in spite of wars raging all around you.
For me, that's very, very interesting that you mentioned because I'm one of those people who look at politics and how things are going in a different route. You look at some of the wars and some of the things that are going on in other countries. And I always used to wonder, why do other nations get involved? And for me, it always boiled down to economics,
Mhm.
finances, money. You don't do certain things because you don't want to dry up your support and getting oil over here or being able to sell things over here. You want to support this country and give money over here. So it's always been a sticking point for me, with those things. But I also look at the challenges that other people face there are certain challenges that we face here that we
Mm.
may not see and understand. A certain war where, and I hope I don't offend anybody in saying this, but a certain war where people are actually, you see bombs being dropped and people are dying and losing their lives. That's actually horrible. It's
Mhm.
it's one of those things that shouldn't happen. But then for me, how I look at it, and I'll just take it back. Why is it happening? What's the cause? Is there something underlining that somebody's trying to do to overtake somebody else? Is somebody fighting for their freedoms that they're trying to do? What are they trying to do? Why are they fighting? What's the reason? Because when you look here, we're fighting a battle as well.
Mhm.
Like you say, with these presidential debates, we have Biden, we have Trump, we have other different parties. Why are there debates? Why are there boxing matches? Why aren't people looking at the actual facts of what makes us better?
Mm.
When you look at those factors, you also got to see, and I just seen something that they say, when you're in a presidential debate, presidential candidates say what they want to do. Whether they can do it or not, they'll say what they want
Mhm.
to do to attract people, to bring people in. I've heard that, different agendas. You have, the African American agenda, you have the LGBT agenda, you have, Asian Americans, you have different groups that everybody wants to target because they want them to vote for them. But are they really doing something to help you? So I don't want to minimize anybody's pain because there's families that live here that have families that live over there, but the battles that are going on over there, people are dying. You can see it on TV. It's horrible. What can we actually do to effectively make change as people is make those changes in government.
Mm.
What's going on? How can you effectively change your government? And I'll be the first one to tell you, I don't think that there's, I don't think that one vote matters at that federal level, but it starts with your local government.
Mhm.
Who are you voting for your mayors? Who are you voting for your politicians in your local communities? How can they effectively bring that up to your state levels? How can they effectively bring that up? So it starts at the local level, making sure you get in there. So voting is very, very important. Paying attention to these issues that are going on in the war are very important. But how does that affect your health?
Yes.
Seeing all of these things that's going on, very, very hard. And I'll say this to you because I had the conversation with my wife the other day. She told me something and she said, I wanted you to be there and understand certain things. For me, I look at cancer. I look at certain things because my grandmother had cancer. You
Mhm.
actually, her mother had cancer.
Mm.
Her brother had cancer. My grandmother had 3 children. Her oldest son died of cancer. My mother died very young, so we don't know if she had, but that's very, very scary. I got married. I have 2 boys. Come to find out now, my wife's grandmother has cancer. One of her aunts said, is that so genetic that I'm not? So it worries me and it makes me think about different things. But then my wife tells me, I don't want to talk about that. I can't do those things. I don't want, so I don't talk about those things in the house. I don't talk about the work that I'm doing because I don't want to affect her mental health.
Mm-hmm.
So what is watching all this stuff online doing for us? Affecting our mental health.
Yes.
And it makes you think about yourself. It makes you think about other things. I know there's people that say, look at these wars that's going on out there. And then when the United States gave money and aid to relieve them, I've heard people say, well, what are you doing to help these people in the United States? You're giving them money over there to help them, but what are you doing to help us? And we got to think about those things. It's very important to help other people, other countries. You don't want people to have certain things happen. I don't know if there's certain resources that are there that if another nation takes over, they're going to charge us more to use those resources. So we're fighting to keep our political and economic balance, or do you really care about the people and you want to help them?
Mm.
Don't really know. I'm not a politician. I don't think I ever will be a politician because I can't. I've watched debates. It's just arguing. It's just a bunch of people yelling and arguing and screaming. And I don't really like politics, but I think it's very important that we understand what's going on to understand how we can effectively first help our own families and then help our communities and then see what we can do outside of that.
Indeed, indeed. And even on that note, let's circle back to, you referenced about 10 or 15 minutes ago, the internships and working with the young people. Expound upon that a little bit, because it seems to me that it's their world.
Yeah.
And we hopefully we won't destroy it totally, although we're just destroying it incrementally at the moment. Expound a little bit about that, because that's really exciting. And I'm particularly interested in how you've been able to kind of work with the school systems,
Mm,
because again, folks will talk about systemic racism, et cetera. But we have these words that are one thing, but also gets working with people, that's another thing, and
yeah.
that might be more important. So to share a little bit more, unpack that a little bit more about the internship. I'm really interested in that.
I will say that has become very, very interesting to me. I didn't do internships when I was in school. I just did the capstone. I did the studies that way, didn't do the internships. But when I finished up my studies, here's what happens when you reach that level. You finish up your studies. I did my personal doctoral work on ADHD and neurodevelopmental disorders.
Mm-hmm.
When I went to school, I did my areas there. I went into the public school system, did all my studies, did all my research. And when I finished, I defended my thesis. And in that defense, there was a couple of professors. It touched a couple of them because one professor had a child that was ADHD. Another professor had another child that was dealing with ADHD. So she invited me to a class to present my thing. So now I go around and do guest lectures on my work.
Mm-hmm.
In that class, it touched somebody and they said, I'm graduating this December and I would love to work with you. I'm interested in mental health and I want to work with you.
Mm.
And again, as you know, when I said I want to create an event for my grandmother, it turned into a foundation. I said, oh, well, sure. Well, you can help me. And as postdoc, you can help research assistants. But I turned that one young lady working with me to talking to the school about bringing in other interns to work with me.
Mm.
And they definitely took on the option. And one of my classmates was working there. She connected me with the correct people. And I said, this is what I want to do. And I started off my first internship with 8 interns. And the goal was around, I did my study on ADHD in the public school system.
Mm-hmm.
And I wanted to see how my actual thesis was titled Attention Deficit Hyperactivity Disorder, Evaluating the Diagnostic Process for Children and Adolescents in the Connecticut public school system. Because at the time, I had schools telling me, I think your child is ADHD. And I said, I think you're not correct. I
Mm.
didn't say that, but I'm going to say that on the show.
Mm-hmm.
Not correct. And during the time I spent going through the process, I watched what they were doing and I was studying what was going on. And I realized the school system was not doing what they were supposed to be doing. And I challenged them at a point in time and said, you should have been doing this, 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 and this. They got surprised that I knew the knowledge and they went ahead and redid it and came back and said, oh, no, your child is not. So when I felt like that, I said, okay, how do we bring this in? And I got other interns and I said, I understand the diagnostic process. I understand how to identify it. But what's the distribution? Now that's the epidemiology side. How is it
Mm-hmm.
distributed throughout the state? And my first cohort of interns worked with me to look at all of the schools in Connecticut, every public school in Connecticut, every single child that was in there, how many diagnoses of neurodevelopmental disorders, and we went through that process, and we start to figure out who needs the most help. So that was that first part, and that bridged me going into my internship with the next set of interns. And right now I have 15 interns working with me. Some are working in finance, looking at health finance, what is going on in the finance market, how do you attract finance as a healthcare industry, operations, we're looking at healthcare management. I have a gentleman that is a doctor as well. He was actually at the event that Saturday sitting behind you. He was there to understand what's going on in New Haven. How can he build more programs to effectively help them if there aren't programs that are already available? And then from there, we started bringing in more issues. I got 8 more interns that are working on research. So these 8 interns are working on 8 other research projects for us at this certain time. The one thing I will say, and when we did the internship program, I will tell you now, the first cohort of interns I had, every single one of them was from India. I didn't have any other ethnic group that applied and went for the internships. They were all Indians that were born and raised in India, came to the States to do their education. They wanted to stay here. And I had about 30 people that, I had about 10 people that applied for the internships, and only 8 of them got the internship, but they were all Indians. The second cohort I did, word of mouth spread because those people talked about it throughout the cohorts. And I had 40 people apply for the second internship, and I took 15 of them. And out of those 40, there was about 35 that were Indians. There were about 3 that were from Africa, and 2 that was from, other countries. Still, no Americans, no Black Americans, but it was all the international students that were the ones that were jumping on these internships. I haven't had any, Americans jump on them, but it was mostly the international students. So that was very, very interesting with me. It did open up something for me because it had me quickly learn how to work with other ethnic groups. I didn't understand from what I would like. There's certain things I can say to another African American, another Black American, that you can't say over there. The language is different. How you talk is different. When I mentioned the time zones when we first started, there was one of the interns where her father lives in India. He's contacted me. We've been on the phone talking. It's been night to him, day for me. We've been on the phone. We were talking. It's been sometimes midnight that I'm on a call. He's 8 o'clock in the morning in his office. We're talking, but I'm starting to understand that country and different things. So it's been very, very important. I want to continue working with interns, not just for the fact of having interns work with your organization, but it's become an educational aspect for me because you said these are the people that are going to lead our future. And each of the interns I work with are healthcare professionals or medical doctors in their own right, and they're trying to learn different aspects as well. And it's been very rewarding to teach them, but also learn from them as well. And anytime I speak to one of them, I have the most doctors that I've worked with are pharmacists. And when we're talking about health and all these things, I'm talking to them about, well, how do these medications affect people? How do these different things, should this be the medication they're taking? They're like, well, not really. I wouldn't prescribe that. I wouldn't prescribe these things. But why? So then you have to look at, one of the studies we're doing is looking at medication. Why are certain medications being prescribed over other ones? Is it because of financial reasons? Are there certain things that are going to, benefit the different industries versus the patient? So I found the internship program to be very, very rewarding. So far, I've worked with the University of New Haven, but I'm looking at working with Southern. I want to work with Quinnipiac. I want to work with other schools. I want to work with interns that are not necessarily in a college program, because I found that to be very, very rewarding. That not everybody goes to college, but that doesn't mean you can't be an entrepreneur. You can't invent something. You can't create something. You can't add to society without going to college. So I want to bridge a gap for those who get out of high school that only want to do certain things. And that's why I've been working with mostly family members. They're still young, bringing them in. I got a 9-year-old and a 7-year-old. I put them in work. Hey, open up this Excel. I want you to input this data for me. I want you to, so, I try to make sure that everything is going. And if you remember me saying earlier, my guidance counselor at high school said, oh, you'll be a teacher. And I thought she was crazy, but I've been teaching since I've left the college. I've always been teaching. I've worked in healthcare as a instructional designer, a trainer, instructor. I've been now moving more towards doing some guest lectures. maybe might become an adjunct professor if the opportunity arises. So if any college is looking and they see something, that's what I'm looking to do.
Excellent, excellent, excellent. We have about 10 more minutes, so as the spirit moves, kind of jump in what might be on your mind. I was curious. Take me back a little bit to the attention deficit disorder situation. Is that concluded, or are you still in consultation with some of the school system? What were your results, or the evidence that you uncovered? Are we moving in the right direction in terms of this issue, or is it still kind of a burning area of discrimination?
It's everything that you just said. And the one thing I don't know is what outweighs the other. But I can definitely tell you I'm still in the process of publishing my thesis. So I'll definitely share as much as I can. What I did know and learn is, and I'll speak on ADHD because that's exactly what I did. But when I started my studies, I wanted to look at neurodevelopmental disorders because one, my oldest son is medically diagnosed as autistic. And there's a lot of factors that played into the reason why, and that's where epidemiology came in. He didn't have to be, but because I didn't understand and she didn't understand, he ended up becoming autistic because of what we would say. I'm working with somebody that's looking at race-based medicine. Because certain medical providers advised us to do one thing, it didn't work out that way, and now we see that he's the way he is. But that made me understand, okay, I didn't want this to happen with my second son, changed it, and it didn't. So when we looked at the school system, I knew my oldest son was autistic. This kid is smarter than anything, whatever. He's just socially awkward. It's just the social thing for him. But then with the younger one, they were trying to label him by association. Just because his brother is, that means you think he is. It didn't work that way. So I was able to look into those factors. I went into the school system, and the key things that I found out was, one, when the school system diagnoses a child as for anything, it's not medical. Is educational. And what that means is if I take my child to school and they evaluate him and test him, and the school psychologist tests him and says, I think he's autistic, that means you think there's autistic symptoms that is affecting his education. That doesn't mean he is medically diagnosed clinically as autistic. And that was the first thing I noticed. And the second thing I noticed is that the parents have the ultimate authority. And there's a lot of parents who don't understand that. When a person comes to you and say, I think your child is this, you have the right to challenge them. You have the right to say, I don't think so. You have the right to say, run tests. They have to do those things. They have to show you those tests. And then they have to explain how they came to those answers. And that's why I felt so good that I was able to learn these things, go in, they explained the test, gave me the results. And then when I said, why didn't you do these 3 tests? They didn't have an answer. When I said, can you run these 3 tests? They did. And when the results came back, they explained them to me. And I said, what do they mean? They couldn't explain them. And I said, the reason why you can't explain them is because this is the reason. And then they sat there and they go, okay. So me being that parent, I was like, okay, I understood what was going on. So that was one side of that spectrum. Being a parent going in without being a medical professional is hard. How do you understand? How do you know? If the school system tells you this and they tell you are, how many children are being raised saying, I'm autistic or I have ADHD? When really, I found out that there's about 11% of children in the United States diagnosed as ADHD. But there's also about, out of those 11%, 20 to 30% have been misdiagnosed. And one of the things I found out in my study by interviewing somebody is 2 things. One, there was a gentleman who works in healthcare. His daughter was diagnosed when she was in elementary school as being depressed. And they put her on depression, antidepressant medication. She didn't get any better. By the time she got to high school, she went to go see a clinical provider and they diagnosed her as being ADHD, changed her medication, and her whole atmosphere changed. And she was able to go off to college and graduate with honors. But when she had a misdiagnosis, mismedication, it didn't really effectively work for her. I had another person who misdiagnosed another child. So when you look at that factor, that doesn't mean that the school system is incompetent of doing these things. It just means that they're not trained. And that means a clinical psychologist gets different training and they use different tools to diagnose a child with a mental disorder. The school system looks at the symptoms of those disorders and says how it effectively affects the child's education. And their whole purpose is trying to say, how do we minimize these symptoms so you can effectively learn in school? But it's not saying, how do we understand your symptoms? How do we treat your symptoms so you can overcome them? And that's why I said, Okay, I learned that through my doctoral studies. I learned that in the process. And you ask, is it done? Not by far. I know what they do to identify a child. I know what they do to diagnose a child. But now we just understand how big that scope is in the state of Connecticut. And now we're trying to effectively understand, okay, well, now if you understand a child, what are you doing to treat them? Not treat the educational, but what are you doing to treat them?
Mm-hmm.
What are the treatments that you're doing in school? And a lot of them are saying that there's nothing they can do. The one thing I found out is going to my children's parent teacher meetings and different things like that. There's a lot of children running around school undiagnosed.
Mm.
I hear the teachers are saying, well, it's hard, your son is being distracted in school because this child is doing this child is doing that. And every time they're saying something to me, I'm like, well, why isn't this child evaluated? Oh, because the school doesn't want to and the parent doesn't want us to, so there's nothing we can do. So the school system had their hands tied, and we're looking at there's something called school-based health centers. I'm not sure if you've
Mm-hmm.
ever heard of them.
Mm-hmm. Yes.
We're trying to look and see how we can effectively use those to go into the school system to alleviate some of the burden of school psychologists and school health professionals, where they can actually go in and help the children with the clinical side of it, not just the educational side. So the work for the school system has just begun. We just entered the market, and we're trying to effectively see how we can go in, bridge those gaps. And again, it started with me trying to help my own children, but being in there, I'm looking at all these other children in there, seeing what they're dealing with, seeing that a child that has a disability affects them, but it also affects the whole class because they're not able to learn. If they have outbursts and disturbances, it affects the other class members. So that's where it starts. And like you said, the children are our future. So how do we effectively help them?
Excellent, excellent. Well, I mean, this is let's affirm if you're willing that this show will not just be a one-off, but you can come back and kind of fill us in
Oh,
as things unfold.
sir, is as long as you invite me, I'll always be here. This has been a pleasure. I didn't even think that I was going to be able to be talking as much and open as much as possible, but I love the conversation. I like what you're doing. I love how you approach people, and you're definitely welcoming. And I'm very honored to have had a chance to be on your show.
Well, it's a pleasure to meet you. And as I say, I want to again the shout out to Lisa and Virginia for having that workshop. The lady that was you're on the same panel with the lady that was into genetics, and I've reached out to her as well because you referenced genetics earlier. So there's
Yeah,
just so much information that I've been doing this show since 2015, but still, it's every day is almost if it's not every day is not an absolute revelation, but there's new things to learn every day.
always.
And that's what's kind of keeping me going. Let me throw a little bit of a curveball at you, but not too much of curveball for the last 2 or 3 minutes. Smoking.
Mm,
I mean, there's been several Surgeon General reports, and I think the first surgeon FDA or whatever Surgeon General report came out maybe in 1968 about these poison sticks. But we're still kind of confronting it. What's your theory about why uh, this poison is still so legally available?
money. I mean,
Big, big tobacco.
oh
So,
my
so, so cotton was once king, now, and tobacco. We forget that tobacco was king. Tobacco still is king in some way.
Oh, and if you think about it, monetizing certain things, and you look at it, I remember when I was younger, um, my parents, my uncles, and they smoked. We used to go to the gas station for them, get them a pack of cigarettes. It was $1 and some change. That was about $20 for a pack of cigarettes.
Mm,
I personally has not ever smoked in my life. I haven't whatever. But if you think about all of the risk factors that can have us live unhealthy lives, why are they
hmm
allowed to be there? Because money. You
mm,
can tax cigarettes. Weed is now legal. Alcohol is still legal. Certain things that you will wonder why, because it has a monetary value. And I
mm,
still say to the fact is, I get it. They don't let smoke in certain places, but when I go into a grocery store and I walk out the grocery store and I'm hit with cigarette smoke, it makes me angry every single time. I'm like,
mm,
why don't they just get rid of it? But if you do, to answer those questions, if you got rid of cigarettes completely, how much money would the government lose?
mm, mm,
If you can
mm.
answer that question, you'll know why we still have
Ah.
cigarettes.
All right. Dr. DaShawn Robinson, it's been a pleasure. This is
Sir.
we're just planting the seed, man, planting the seed, and
Yes,
gonna
sir.
gonna grow up to be a sequoia. So stay tuned. Have a great summer. Perhaps we can kind of reconnect in the fall if the spirit moves you. You know, maybe bring on some of your interns, however you want to kind of
Oh, please, that would be great.
create it. That would be great to see.
Yes,
Thank you so
sir.
much, man. I'm tempted to ask you what you're doing this afternoon, but I'll let that for the next time because you're a busy man. So thanks for taking the time.
No, thank you very much for the time. I appreciate it. And whenever you call, I'll be there for you, sir.
Excellent. Well, I appreciate that, man. Thank you
Thank you
so
very
much.
much.
It's been great.
You too, sir. Thank you.